All right, it is 8:32, and Senator Bill Cassidy joins us on the line. Good morning to you, Senator. How are you?
I am fantastic. How are you two?
It's good talking to you. I am actually solo today. Bernie is, I don't know, maybe going to cover some news in Bermuda or something. She's there for some reason. I don't know why.
Because she wants a break from you, man.
Yeah, that's the truth. You know what? We all deserve one. Last week, you're set to call in, and you called in right on time, and we were in the middle of another major flooding situation here in Acadiana. A ton of rain in about an hour span of time. It just overwhelmed everything. So I apologize that we missed our date last week, but it's kind of an ongoing problem for us down here.
Well, it sets the stage. One thing we've been working on is the National Flood Insurance Program, and one aspect of the reforms that I am proposing would be $400 million a year going towards mitigation, meaning that if a community is prone to flooding, then here's $400 million that can be used to help prevent flooding. A stitch in time saves nine. It's a lot better to protect on the front end than to pay flood insurance on the back end.
You know what? Whatever help we can get, we appreciate that work that you're doing. I want to talk about in California, there's I want to call it Medicaid expansion. I'm happy that we haven't seen this happen quite yet here, but expanding Medicaid to illegal immigrants in California and the worry that it could really overwhelm the systems there. What do you know about it? What are you hearing? And should we expect this to be proposed in Louisiana?
It won't be proposed in Louisiana. Californians are paying the full freight of that. My experience, I did my medical residency. Your listeners may know I'm a doctor. I worked in the charity hospital system of Louisiana for 25 years. And so I did my medical residency in Los Angeles. And believe me, you're a doc, you take care of patients. That's your first goal. But you couldn't help but notice that there would be people coming from foreign countries with notes saying, take care of this patient for this condition. It might be written in Spanish. It could be written in Armenian. But they were coming to get free health care. And in a sense, the fact that I worked in a charity-type situation was a magnet for people to come to our country illegally and consume a lot of health care and then go home. I think we just supercharged that magnet, or at least California did. And the tragedy is California has lots of needs. Medicaid doesn't pay very well. So if you have Medicaid and you're an American, you may not still get to see the doctor you want to see. They've got a homeless situation in which they have hepatitis A spreading, but now it goes beyond the homeless population and to people who aren't homeless. They've got measles outbreaks. I could go on. So the $100 million they're spending on this, they could spend on taking care of our fellow Americans, and I think that's probably where they would like their tax dollars to go.
I want to ask about this and how Medicaid and Medicaid expansion especially plays into it. I was talking to a local OBGYN a couple of weeks ago just about, I was just interested from his side of things, how it's working out, what he's seeing, a difference in patients. And he said there's a few things. On the patient side, those because of what has happened, and even on a national scale with Obamacare and with how insurance coverage has just changed, you have a lot of people, even if they're not on Medicaid, they're on high deductible plans. They're foregoing let's just say in his situation, it was like a tubal ligation, having your tubes tied. That is something that is elective, a lot of times as a means of birth control. And they're not doing those. So he's talking about he's not doing the surgeries he was. He is getting more and more Medicaid patients, which he does accept in his office. But it is really changing the business that he's built up. And he employs about 15 people in his private practice. Are you hearing that from providers across the country?
Well, there's a little bit. Let's unpack what you just said. Again, speaking as a physician who worked in the charity hospital system for many years, a lot of people dropped their private insurance with Medicaid expansion and went on to Medicaid. So taxpayers are now footing the bill for that which it used to be an employer and the employee paying for. Next, if you're on Medicaid, the attraction of it is that you don't have a deductible and you don't have a copay. And so if you're lower income, then you're doing better off. But under Obamacare, what happened is that the Obamacare effectively jacked up the rates for middle-class folks. So if you're not getting a subsidy, or if you're not on the expansion, then you're paying far more for your insurance. The greatest case in point is Moon Griffon, KPEL's own Moon Griffon. Moon Griffon, a couple years ago on the radio, mentioned how he has a special needs daughter. He's open about that. And he has to have insurance. He's about 60 years old, I'm guessing. And so he went to Blue Cross. This is 2 years ago. His annual premium was $40,000 after-tax dollars, with, I think, a $13,000 family deductible and an additional deductible or copay or coinsurance for drug costs, which he has to have for his daughter. So he could reasonably be out $50,000 after-tax dollars before his insurance fully kicks in. Now, so the lower-income folks are taken care of, but a guy like Moon Griffon, who's working and making it go for it, not that lower income don't work, but I'm just saying a middle-class guy like Moon is paying $50,000. Now, this changes the whole business atmosphere for Moon Griffon and everybody like him. And the irony of the situation is it used to be if you worked hard, you'd get a 4-year insurance. Now, in some situations, you absolutely cannot, and that's the situation we're in now.
I can imagine situations like are going on in California. It's just going to spell more bad news for the middle. I mean, a lot of people think of California. They think everyone lives in a $5 million mansion in Beverly Hills, and that's just not the case. Just the nature of how many people are there, there was an enormous middle class in California that I will imagine will ultimately suffer for these changes in Medicaid.
Well, so California's poverty rate is as high as Louisiana's, if you include housing. So think about that. Louisiana just has poverty that's been with us for a couple centuries now. That wasn't always the way with California. This has been something which has developed. But California does several other things. But let me that kind of worse than this, and their middle class is leaving because they can't afford the taxes. But let me mention some good news, though. The good news is that we're working on things that will decrease the cost of health care and health insurance for middle-income families, frankly, for all. We're taking on something called surprise medical billing. The patient, you and me, we go to the hospital, it's in network. Turns out at our surgery, there was an out-of-network piece of equipment. And so we're billed for an out-of-network piece of equipment, even though everything we researched told me that the hospital was in network and my doctor was in network. And the bill for the equipment might be tens of thousands of dollars. So we have a piece of bipartisan legislation. We think it'll pass and be signed into law, in which the patient is taken out of the middle. If the provider and the insurance companies want to go after each other, God bless them, let them do it. But the patient's out of the middle, and she's held harmless, and these folks can figure out their differences in another way.
Wow. Senator Bill Cassidy, thanks so much for your time this morning. Very interesting. We'll see. I just don't see this lasting very long. Even in California, where they have such a huge population, a lot of taxpayers, there's no way they could sustain this. I mean, I just don't see it happening money-wise.
Well, I think it's going to be they're going to restrict it to younger people to try and limit the cost, but it's just going to be a magnet. And as that magnet, the cost is going to grow. The irony is California's economy is doing fantastic under Trump. Under Obama, they were running a deficit. Now they got a $22 billion excess. So they hate Trump, supposedly, but they're doing better than they ever have. Wait until we go back to having one of their own party, the Democrat. No offense to the Democrats listening, but if we go back to the policies under President Obama, high regulation, threat of taxes, etc., their economy may have that downturn, in which case that was probably when they would reconsider all their generosity to folks who are from elsewhere.
All right. Thanks, Senator, for your time. We appreciate it.
Thanks, man.